Amoebiasis. Welcome everyone. Today we are diving into an important health topic that affects millions worldwide, and this is amebiasis. What is it? How does it spread, and most importantly, how can you protect yourself and your loved ones? Let's break it down together. Amoebiasis is an infection caused by a tiny parasite called Entamoeba histolytica. It mainly attacks the intestines but can also spread to vital organs like the liver. This disease thrives in places with poor sanitation and spreads through contaminated food and water. Understanding how it spreads and recognizing its symptoms is the first step in protecting yourself and your community. Let's go through its journey. The journey of Entamoeba histolytica has two key stages. It has got a cyst stage and a trophozoite stage. In the environment, the parasite hides in a protective shell called a cyst. These cysts are first in the feces of infected people and can survive in soil, water and food for several weeks. You become infected when you swallow contaminated water, food, or even touch your mouth with unclean hands. Once inside your body, the cysts hatch in your small intestine, releasing active forms called trophozoites. These microscopic invaders travel to your large intestine, multiply and cause damage. Some trophozoites transform back into cysts and leave your body through feces, ready to spread the infection to others. In severe cases, they break through the intestinal wall and invade other parts of the body. They can spread to your lungs, they can spread to your liver, and even your brain. Well, amebiasis doesn't always show its face clearly. It can range from no symptoms to life-threatening complications. Many people are asymptomatic. They carry the parasite without knowing it. No symptoms, no warning signs, but they can still spread the infection to others. So even if you feel fine, getting tested is crucial if you live in or travel to high-risk areas or get in contact with contaminated food or water. Intestinal amebiasis is the most common form. It's able to cause inflammation in your intestines. It's good to look for number 1, diarrhea, which sometimes are characterized by the presence of blood and mucus, abdominal pain and cramping, fatigue and weakness from dehydration, loss of appetite and weight loss, nausea and fever in severe cases. In extreme cases, ulcers can form in your intestine, which can lead to life-threatening infections. As earlier said, when the parasite escapes the intestines, it targets other organs, especially the liver. With the liver, the most common complication is amoebic liver abscess. This is characterized by high fever and chills, severe pain in the upper right abdomen, which may spread to the right shoulder, unexplained weight loss and night sweats, and in some severe cases, there could be jaundice. When Entamoeba histolytica travels beyond the intestines and liver, it can cause severe, sometimes fatal conditions. It may cause lung infection or pulmonary amebiasis. So if the parasite reaches the lungs, often from a ruptured liver abscess, it can cause number 1, chest pain and persistent cough, difficulty in breathing and shortness of breath, coughing up bloody mucus in severe cases. Lung involvement is a medical emergency as it can quickly lead to respiratory failure. Then brain infection or cerebral amebiasis, but in rare cases, the parasite can reach the brain through the bloodstream. This is life-threatening and causes number 1, severe headaches, seizures and confusion, coma, which can also be fatal if untreated. Cerebral amebiasis is rare but deadly, requiring immediate intensive care. Skin ulcers. Now, though less common, the parasite can cause painful open sores on the skin. These sores or ulcers often appear around the buttocks or genitals, especially in people with weakened immune systems. Now, skin lesions can become infected, leading to further complications if not treated promptly. Now, having addressed the symptoms and how Entamoeba histolytica spreads, let's see its prevention. Now, since amebiasis spreads through contaminated food and water, prevention starts with good hygiene and sanitation habits. Here's how you can stay safe. Always boil your water for at least 1 minute before drinking. Use bottled water or filtered water, especially when traveling. Say no to ice cubes from unknown sources, they could carry the parasite. Wash your hands thoroughly with soap and water, especially before meals and after using the toilet. Use alcohol-based sanitizers when soap isn't available. It's good to teach our children on proper hand washing habits. Wash fruits and vegetables thoroughly. Cook food properly, especially meat and seafood. Avoid raw or street food in areas where sanitation is poor. Always use proper toilets. Never defecate in open areas. Ensure safe disposal of human waste. Keep your surroundings and toilets clean and disinfected. When visiting high-risk areas, Stick to bottled or purified water even for brushing your teeth. Avoid raw salads and pit fruits and street food in unhealthy places. If you experience symptoms, visit a healthcare provider immediately. Complete your full course of treatment even if you start feeling better. If you are a carrier without symptoms, treatment is still essential to stop the spread. Amoebiasis may be common, but is completely preventable. By practicing good hygiene, ensuring clean water and promoting proper sanitation, you can break the cycle of infection and protect your health. So, let's stay informed, let's stay clean, and let's stay safe. We can eradicate amoebiasis. Until next time, stay healthy and stay aware. Thank you.